Hello everyone, my name is Chan Chot Yi. Your lecturer will be deliver the class for the biopharmaceutics and pharmacokinetics. And today we have your friend with us, two of your friends with us on this class of this interactive class. And let me introduce them.
Hello. Yeah. Hello, I'm Suchi,
And I'm Serena.
yeah, I'm from Selangor.
I'm from Malacca.
So you guys has been in your virtual class during your second year, right? Am I right? And how about your first year? What is that? The fully physical class that you have attended?
We have one sem of physical class and another sem of online.
So how do you find it? Do you, because your first year is only one semester physical, do you think that you are still close with your friend, or how do you find it?
I think we are quite close for just one semester.
Yeah, not too bad, not too bad.
Yeah.
Yeah.
Right. So what was your understanding about bioavailability?
It has percentage.
Yes, it has percentage.
It had
Yes.
percentage.
Yeah. Anyone?
The drug available in your body to take
Yes.
effect.
So basically, bio means biological system. Availability means whether or not they are available in this system, and how much of them being available in this system for the therapeutic effects later on. So in terms of designing the formulations, so we are looking at the drug concentration that actually go into your bloodstream. Okay, so in this formulation scientists, we are sort of like assuming if the amount of drug that's already entered into your body, they are being available to carry out these therapeutic effects. So this is what you call bioavailability. So to define it, it is actually how much of the drugs that has been arrived in your bloodstream, okay? And the amount is one of the aspect, and there is another aspect, which is, for example, you have taken a drugs, for example, your headache, and would you be actually suspect your headache to resolve in a week's time or in 30 minutes time? So beside having the amount, the time, okay, the rate of this drug actually enter to your bloodstream to carry out these effects is also one of the concern of bioavailability.
Yeah, just now doctor said about how fast it acts. Is it like is it related to like the onset of action and the duration of action? Does this all this related to bioavailability?
Yes, it is related to the onset of actions. For example, if you have designed a formulation that if it is fast to arrive in your, to reach your blood circulations, then of course it will have a faster onset, right? And if you have one with a very low bioavailability, or they have the rate of arriving to your systemic in a very slower rate, you will expect the onset to be slower. There's a difference when you talk about the onset of time.
So does it like depends on the route of like administration into our body?
Yes.
Like by
Yes.
injection
Yes.
or by oral or
It is very much depend on the route of administrations. So I think you have learned about route of administration. Give me 5 different route of administration, maybe.
wow, 5
Oral.
oral, IV, IM,
Subcutaneous.
intraparenteral.
Okay.
But like those suppository that
Yeah, for example, those suppository, yeah, or pessary, they are all products, okay? Those products, they enter through the different special, very specific route of administrations. And when you learn about this different route of administration, perhaps can you recall some of the advantage and disadvantage of route of administration, and also like when do you use it?
It depends
Yeah, if I
on
want
how
faster.
fast you want the action.
Yes, when you go using IV, then it directly go into the bloodstream. So strictly speaking, they are circulating in the body, so they are fast. You have also a sublingual that is also quite fast because of this, they put under the tongue. And what do you think and why?
There's a lot of blood vessel, is it?
Yeah.
Yeah. So there are some reason that you choose either using this enteral or parenteral route, like what Yap has mentioned. You want to get it fast, or it is related to the onset of action that you are expecting, or actually there are conditions that you require parenteral. Okay, for example, you have patient that is unconscious. So when it is suddenly unconscious, they could not actually perform this swallowing actions. So, and this peristalsis in your intestine or in your esophagus could not be functioned. And this is where parenteral route is preferred. Let's say there's a drugs that enter orally. Okay, orals means enteral. Enteral means in Greek, enteral means intestine. So anything going through the oral are called enteral. Okay, there are another type of route of administration, which is if you look at the words parenteral. Okay, it is actually coming from the para. Okay, the first phrase is para means besides, other than. Enteral. Enteral is oral, other than the intestine. So anything that go away from the intestine, they are called parenteral. So example of parenteral, for example, you have the IM, you have the IV, or even you have some other which is not going through this intestine. They are called parenteral routes. So after your drug have actually gone through these different routes, let's say oral. So what are the mechanism of absorptions? And can you think of any kind of mechanism that you have learned before? So
Any tips?
yes, tip. Maybe I still remember about around 5 different mechanisms that you can possibly think
Oh,
of.
5.
So maybe I give you a little bit more tips. When you're drunk taken orally, where is the space for nutrient for absorption? Where is the one?
Intestine.
Intestine.
Yeah, intestine. And is there any absorption happen in the stomach?
No. No.
More on probably disintegration and dissolution in the stomach
Right.
before it gets
Yeah.
absorbed into the intestine.
Very good. I think Prof Yuen will give you a thumbs up. There's some absorption actually happen in the stomach, but actually not very much. Majority happens in the intestine.
Diffusion.
Yes, passive diffusion. So what are these factors that affecting the passive diffusion?
Concentration gradient.
Yes, concentration gradient. Very good, very good. So that is a passive diffusion when you have a high concentration at one side and a low concentration, and you got the gradient and it will pass through this membrane. Okay, and is there any other mechanism that you can think of?
Active transport.
Yes, active transport is another one of them, that you need an agent actually to bring these drugs from the lumen of intestine into this bloodstream. So the active transport is the one that require energy for that to happen. And there are also some types that not require energy. You call it facilitated process of absorption. So you have passive diffusion, you have facilitated transport, and also active transport that is require ATP. What are the others type of mechanism of absorption? Two more.
More. What cytosis? Exocytosis.
Yeah, exocytosis and also endocytosis. Those are also part of this absorption mechanism. So among the different route of administration that you have seen, let's say IV. IV is the one that is go directly into your bloodstream as far as the formulation is concerned. So the amount of drug available in the bloodstream should be similar to whatever that you administer, right? Because they go directly to your bloodstream. So what do you think about this bioavailability of the IV administration? What is the percentage that you are looking at?
100%.
Yes, correct. Thank you. And so it is 100%. So now let us get into others example. For example, you have a drugs, okay, paracetamol that we put in into this oral administration, and let's say you take within this tablet you have 10 molecule of as paracetamol, and only 2 of them is being absorbed and the rest of them being drained in this toilet. So what do you think is the percentage of paracetamol, percentage of bioavailability of paracetamol of this formulation? What do you think?
20%.
Yes, correct. It is simple mathematics, right? So let me give you another example just to make sure that you understand what am I trying to say. Let's say the same thing. We have another tablet that we have also the 10 molecule of paracetamol in, and only 5 of them is being absorbed, another 5 is being drained. What is the percentage of bioavailability now?
8%.
Yes, very good. So I think pretty much both of you have understand what is meant by bioavailability. So in a real life situation, let me give you an example. Once again, the tablets that we maybe ask Selena to take it, and then because we want to know the concentration of drug that reach her bloodstream. So what we would do, we would take this her blood of the small ml of her blood, right? So in order to calculate the bioavailability in this case, what do you think is the denominator that we should put in? Is that 500 because we asked her to eat the 500 mg? Is that the case? That
Yeah, should be. Technically, yes.
So technically speaking, the answer is a yes. If the denominator should be the total amount of drug that is given in the root, right? But however, that is provided if Selena blood circulation is not circulating, because she is a human being, that she's a living creature, that she go to toilet, that she hurt by the boyfriend, that she cry, that she sweat. Okay, so when you have the drugs go into this oral route and being absorbed into the bloodstream, the drug is not only increased in the linear manner, but it will decrease somehow. So it will be affected by the excretion and also metabolism of your body. So in that case, how do you calculate this bioavailability? So what you can do is you take after this oral, okay, you take this amount of blood sample from Selena, for example, and then in another occasion that you actually inject into IV. IV means that you already get rid of other kind of defense and everything is going into, because IV is presumably 100%. So then this percentage of drug reach to your blood circulation in the oral route being divided by the concentration that you take from the Selena after IV injections. So this is how you calculate this bioavailability. Always compare with these IV injections. And also when you talk about the different percentage of bioavailability that is can be calculated, there are 2 different type of bioavailability that you will see, which is the absolute bioavailability. Is what we have just mentioned about this comparison between this concentration of drugs in comparison to the IV route. Okay, there is something called relative bioavailability, whereby you compare the bioavailability of different formulation. For example, these tablets, they have bioavailability of 50%, and the capsule, they have a bioavailability of 80%. And what is the relative bioavailability of the tablets to the capsules? So you simply divide the bioavailability value of the tablets to the capsule. And here comes this relative bioavailability. This is to compare the different products that is have out there, right? Which one is better? So in any occasion when you are comparing the relative bioavailability of, for example, tablets to capsule, if you look at how they are being calculated, actually you will actually slash this the IV. Okay, so you no need to have the value of the IV anymore when you calculate the bioavailability, relative bioavailability.
So we can also calculate different, like the tablets
Yes,
to tablets.
can. You can actually compare different tablets from one brand to another brand. And also, what do you think about usually the bioavailability? Do you want to expect to be high or actually low? What do you think?
High.
Why do you think it needs to be high?
High. That means there's more drugs being absorbed body.
Better
And
effect.
so let's say now you are drug manufacturer, okay? You are the boss, like Zichin is the boss, and then you invest on me, and then I produce tablets, and I tell you my formulation is only effective for 50%. You as a boss, what is your comment about this?
Don't want.
Don't want. Why don't want?
50% only no. So
But what
that
do you want
the
higher?
patient don't have to take so high dose.
Yeah. Yes, you are a very kind boss that you really concerned about the patients. And says if I have the 50% of bioavailability, meaning that you have to buy 1 kg for me, and I will just use up the, you know, the effective therapeutic is only 50%. Okay, and in comparison, let's say if I increase into, let's say 80% of the powder that you have bought to me, 1 kg, is actually effective, and maybe I can reduce my tablets from 2 tablets into 1 tablet. So at this point of time, let us summarize, you know, reflects what you have learned from me in the sessions today. Says, you know, can you please define bioavailability?
Let's see. The percentage of drug available in the systemic circulation.
Right, good. Right, very good. So when you define as the percentage of drugs that is available in the systemic circulation. So the point that you are having is actually the percentage, and the systemic means the bloodstream. Okay, now says I'm in a formulation concern, I reformulate your answer in the sense of, like, you know, if you recall back, we talked about the onset of time, like, do you agree to have the headache resolved in 1 week? Okay, so of course the rate is actually one of the very key point that you want to recognize for bioavailability. So now I come back to the definition of bioavailability is about the rate and also the amount, which is the extent of the drug is going reach to your systemic circulation. So that is the best definition that I can actually provide. And also you can tell a little bit further about the concept that you understand, for example, how to calculate them using this formula of comparing between your formulation to this IV. For example, bioavailability is equals to such and such a blood concentration of drugs divide by the blood concentration of drug using the IV route. Then this will be a complete answer for the concept of bioavailability. Any more question that you have on the concept of bioavailability?
Oh yeah, doctor, you said about the rate, right? You need to plot the graph, right? So what about the graph? Like, do we calculate the bioavailability from that graph?
Yes. Okay, when you plot the graph for this bioavailability, what happens is your y-axis is actually the drug concentration, and your x-axis is your time. Okay, so for example, once again, we ask Selena to take this tablets of paracetamol, and then after 1 hour, then we take her blood sample, and then we go and analyze what is the drug concentration. Okay, and then we plot at time 1 hour what is the drug concentration. Then we put a cross, and then you will see this drug concentration in her bloodstream will be increasing in a manner, but then up to a certain point it will be decreasing. Why is it increasing? Simply because the time that she take, okay, it has yet to be absorbed. Okay, it takes some time to absorb because it needs to disintegrate, it needs to dissolve, and after that it absorbs. After the absorption happens, then you start to have some drug concentration in her bloodstream in an increasing manner. But in comparison with IV, if you have the graph, you need to plot for IV injection, for example, because you want to compare with the 100%, right? So IV, when you right away you inject, what would you expect the drug concentration? It should be, right? It should be high as possible because it go direct to your bloodstream. So then you will expect this graph for this IV injection start at 0 time point from the higher point, and then it's go down because of the excretion process. It does not have the absorption process. And other than IV, they do have absorption process. Even IM, intraperitoneal, they need to go through the cell and then go into the bloodstream. So those are the one that are involving absorption mechanism, and you will see the graph like this. When you calculate the bioavailability, then you will need to calculate the area under the curve. This is where the integration comes in. Okay, the integrations of formulas actually means area under the curve. So you actually take the area under the curve for the tablets divided by the area under the curve for this IV, then you got the percentage of bioavailability. Is that clear? So we are more and less cover this concept of bioavailability, and first thing is the definitions, and of course all those prerequisite knowledge that you need to know, you have to know. Okay, so we are now about it, and thank you very much for Selena and also Yaps for participating in our conversation today. Thank you very much.
Bye bye.
Hope you guys enjoy.